please come and set the context for the seminar and also say a few words about Sukarya.
Our keynote speaker and a very honored guest, Mr. Ajay Kumar Tirkey, Additional Secretary, Ministry of WCD. We are really grateful to you for your support. Invited speakers from US, Bangladesh and Nepal, as well as from within India, and the subject matter experts and all esteemed attendees. It gives me immense pleasure to welcome you all here in New Delhi on this pleasant morning. It is indeed an honor for Sukarya to host this conference on public health and nutrition in technical partnership with the National Commission on Protection for Children's Rights and in strategic partnership with the Maternal Child Health Program on Milken School Institute of Public Health at George Washington University, Washington, D.C.
We all know that anemia is a silent killer in the developing world. The statistics of the National Family Health Survey in India tells us that every second Indian woman is anemic and 1 in every 5 maternal deaths is directly due to anemia. Friends, these are massive numbers to deal with and need equally massive response. If a woman is malnourished during pregnancy or if her child is malnourished during the first 2 years of life, their physical and mental growth and development may be slower. This damage incurred cannot be repaired at a later date and continues to affect the child throughout their life. So, this is a wake-up call for all of us to take a very serious attitude and approach towards those who are working relentlessly in these areas. I strongly feel no mother and child deserves to suffer when the cause of that suffering can be easily prevented, managed, and alleviated. Hence, why should we carry the fear of our future generations being stunted or wasted? Why can't we resolve this? Today, we have an important opportunity to shape the development priorities of the future. Let's get the best out of it. Let's work together, collaborate, and share our resources to achieve our common goals. I would like to share a beautiful quote from our father of nation, Mahatma Gandhi. The difference between what we do and what we are capable of doing would suffice to solve most of the world's problems. It can be true in our case too. We can all be the change makers. So for me, it is time to act now. It is a long-term need to free women and children from the prevalence of malnutrition in our society. I consider it as a dire need and foremost priority.
Malnutrition in South Asia as well as in India has a significant impoverishing effect at both the macro and micro levels and undermines national development objectives. Therefore, to address the problem of stunting, underweight, wasting, malnutrition, especially in children, there is a need to take up sustained efforts requiring multi-pronged approach and bring grassroots synergies and convergence across platforms, across the ministries, across departments, in participation of the state governments and the union territories. Therefore, on 8 March 2018, Honorable Prime Minister launched the Poshan Abhiyan, which is called the PM's overarching scheme for holistic nourishment, and this was done in Junjunu in Rajasthan. The program targets to reduce the undernutrition, anemia among young children, women, adolescent girls, and reduce low birth weight by at least 2%, 3% and 2% per annum respectively in the 3 categories.
May I request Founder Chairperson Meera Satpathy to felicitate him.
आप सब लोगों को आज जो विषय आपने लिया है बहुत ही गंभीर विषय है और गंभीर विषय न्यूट्रिशन को हम कैसे ठीक कर सकते हैं, इसलिए हम ऐसे सभी चीज़ों के बारे में हमारा ध्यान है। बड़ी संख्या में यहाँ आई हुई हैं और आप पोषित बच्चे पैदा हो और कुपोषण का शिकार ना हो, इसके लिए दवा के अलावा स्वच्छता और साथ साथ उनको उसी वातावरण में खान पान का अभ्यास कराना, ये अगर हमने कर लिया तो शायद आधी से अधिक उपलब्धि हमारी हो जाएगी।
I truly believe that investing in adolescent girls might be one of the highest returns on investment available in the developing world, right? Because one, adolescence, the second most rapid time period of growth in a woman's lifespan, is when they are growing both their height, right? They're also growing socially and cognitively and physically in other ways. When a community invests in a girl, right, an adolescent girl in particular, she can marry later, perhaps experience less violence, and have healthier children. Nutrition is a key component of that. And so what I put out to all of you today is that we truly must focus on this adolescent girl time period across the life course. It will provide better outcomes, not just for girls and women, but for their families, for their communities, and ultimately for the economic prosperity of India.
The problem is, most of the time we plan from top and try to implement it at the bottommost level where it fails. Solutions to all community-based problems are in the community itself. We just need to take it out and replicate it. So there are positive people already there in the community who can be fantastic volunteers. There's already the money, the resources, everything inside the community which can be used. And then you have these positive families or positive deviant families, as you say, from whom we can learn and just replicate the processes to children who are malnourished or anemic. It can be applied to any topic, whether it is anemia, it is sanitation problems, it is malnutrition, it is anything. But when we go down and start teaching these people what to do hands-on, some basic things, yes, you can tell them or teach them, but 90% of it should come from the village or that slum itself. So I think this is the first thing that we need to understand, that let's not make programs and proposals which are top-down. Let it be bottom-up. Let it be made by the community.
Nutritional status of one generation of women affects the nutritional well-being of future generations into their childhood, their adulthood, later on when those children become pregnant and have their own children. If this cycle is not broken, an intergenerational effect of malnutrition can perpetuate generations of short-stature mothers, leading to additional poor educational outcomes, educational attainment, and then continuing the cycle of higher risk for pregnancy-related mortality and morbidities. I had a clear understanding of approximately 20% of stunting and chronic malnutrition begins in utero. Many programs focus implementation and evaluation efforts on infant and child health, as opposed to focusing on preconception or even adolescence. The nutrition education for women prior to pregnancy, during pregnancy, and lactation really needs to be amped up and make sure that it is appropriate for the context that women are in.
So there are two major challenges that the urban women and children in slums are facing. First is the health is not their priority, because these are the migrants usually who just are meeting their daily needs, and there is a hesitance to use the public health facility. If you look at the health systems, the way urbanization is growing, the way the cities are growing, the urban health system is not been keeping the same space, because the health infrastructure, the services, the kind of services that has been offered to the most secluded or the vulnerable slum are not growing. So these are the two major challenges, and above all this, we have many women who are still dying in the slums. There are children who are stunted, and still there is an under 5 mortality. So where the areas we are working in, still the child deaths are happening in Mumbai. So Sneha actually worked with one of the major approach we have is strengthening health systems
we don't believe in starting our own parallel health services, and we have been working with strengthening health systems.
Dr. Poonam Therpal Singh, World Health Organization Regional Director for Southeast Asia, said, Bangladesh is one of the top countries in my areas in terms of healthcare system, especially its ownership of community in primary healthcare system is better than any other regional country. Yes, we have achieved, and there is a magic. What is the magic behind the miracle? You can see that Dr. Poonam has given emphasis on the strength and effectiveness of primary healthcare system. Our primary healthcare system is extremely organized and effective at the root level. And the main thing is our community clinic. And our community clinic is serving, each community clinic is serving 6,000 people in a demarcated area.
Hi, this is the main problem in Nepal. So there are certain barriers to get healthy food in Nepal. For example, poverty is the main issue. About a quarter of Nepalese people are below the poverty line, and they have the poor accessibility and affordability of the food. And the status of women in the society is poor, and the women, they have the low skill. And the culture and the religion is another factor to serve the people. And the people, they don't have the choice. They have very limited food, and the health-seeking behavior is also poor, and people believe on the spiritual healer rather than going to the modern healthcare practice. And a vast majority of Nepalese people are still living in the rural area, and majority of the people, they don't have the proper knowledge of the healthy food, and majority of the women are still either uneducated or have the low level of education. So these are the key barriers.
30% of pregnant women are consuming, only 30% are consuming iron folic acid. 41% children are breastfed in first 1 hour. See, all data are below 50. And that is what is the behavior change data. Whatever you bring, whatever you iron folic bhi le aao, calcium bhi le aao, but if people are not eating, the behavior change has to come. And that demands the education. And if you don't involve the caretaker, which is a man, and also the grandparents, things will not change, because mother don't stay at home all the time. They go for a labor work.
Looking at this figure is that there are certain points of intervention that have been shown in the evidence that have had positive effects, most of which are shown from preconception to the first 1,000 days of birth. And this is sort of just a very simplified version of the major direct neutral interventions that we know have worked in these specific stages of a woman in a child's life. And while there is much evidence to indicate that vitamins and supplements can help reduce malnutrition and anemia, there are major gaps in the implementation of a lot of the programs that are currently in place. There needs to be much more guidance and counseling on the supplements and the vitamins and how often we need to take them and how the adherence of them and how long it should be. You are taking the right amount of supplements and vitamins, but also having an appropriate nutrition, like engaging in appropriate diets. We want to make use of community health workers who can implement this and track women as they take supplements and help them follow up on appropriate diets. Community health workers can also help with the facilitation of support groups where women can share their own experiences with each other in their communities.
This concept framework was given by Stuart Gillespie in 1990 for UNICEF, where he clearly told you that nutrition will never be solved by a feeding problem. It's not a feeding problem. We don't have enough calories, give it and we'll be done. No, there are underlying factors. There are underlying factors like education of the mother, the empowerment, the agricultural produce of a country, which influences what we consume. And also, if you go down, all these determinants exist in an environment, enabling environment. If I'm giving you the best nutrition right now, but abusing you simultaneously, will you get nutrition out of it? Research, policy, academia, we need to build capacity of all the three sectors to be able to create a cadre of public health nutritionists who can tackle this. And therefore, my plea to ladies and gentlemen here is telescope the transition. Don't sit at the audience on the receiving end.
telescope it beforehand. Focus on appropriate nutrition rather than undernutrition, overnutrition. Forget those terminologies. Appropriate nutrition is what we need. And in a life course approach.
So people's perception is important. Perception change and behavior change is required even in health-wise and education-wise advanced stage. If they haven't felt the problem, they are least likely to respond to it. Today again, globally and in India, we are talking about 3 strategies to combat micronutrient deficiencies. One, we must have a long-term perspective. We can't always be becoming prey to short-term gains. The long-term measures for prevention and control of micronutrient deficiencies that exist today and that which will arise definitely in some future is always dietary diversity. Eat a variety of normal food. Medium term, we need to emphasize nutrition education and increasing awareness about the importance of nutrition and health. In the short term, food fortification appears to be an effective, inexpensive and sustainable method of combating widespread micronutrient deficiencies, especially in countries like India.
Coming to iron deficiency, I think it's really a difficult area to cover and also to control, because iron is a very difficult metal which requires understanding the physiology of iron metabolism, the iron solubilization in the body, how it is absorbed. Mainly I am talking about the bioavailability. The other aspect I would like to make the audience or the delegates understand is it's essential to create the body iron store to eliminate iron deficiency anemia. Without that, I don't think you will be able to eradicate or create anemia Mukt Bharat. It's very difficult without having the storage iron built in the body. So this is actually the message I wanted to give. Food synergy by simultaneous consumption of fortified foods and the vitamin C fruit actually doubles your absorption. That will enable you to create establish the store and also reduce the anemia.
That regular consumption of these micronutrient fortified staples helps to meet 25 to 30% of our day's requirement. So we are not saying that fortified foods should replace the dietary diversity, or we should not have a diversified diet. It only helps to bridge the gap between our requirements and our intake. Fortification outweighs the cost advantages, and the World Bank considers it to be one of the most cost-effective strategies, because the investment on fortification vis-a-vis the benefits that we achieve on savings on health care are enormous.
Let me at the outset say that if India is not doing well on malnutrition and also on hunger, which is also related to child mortality, etc., it is primarily because of badly designed programs. And we have not talked about these programs like the ICDS or sanitation or food security or health. And these programs, apart from having a governance issue with which some of us are familiar, there are also design programs. That is, these programs are not well designed, and that design needs to be corrected at the government level.
One has to take into account the public interest areas whenever you develop the policy, legislation, strategy or programs or protocols. Every policy has to pass the test of public interest, public purpose and reasonableness. Nutrition sector is Bad, Vibad, Visambad, Bharpur hai. There is no stakeholder alignment, no message alignment. Within the government, there is no alignment. Private sector, within private sector, government, private sector, NGO. So we need to bring alignment together for better governance, better policy.
Governance is the one of the best thing to address malnutrition And Nandaji was talking about the, just a few minutes back about how the nutrition and health came together. And governance here, like how we are taking this governance at different level, how the monitoring of the program is taking place, how the different level like the district level, block level, sector level, how the program review is taking place. And coalition is helping some of the state governments in developing multi-sectoral program, multi-sectoral planning at district level, how all the departments are coming together and preparing the plan. Poshan Abhiyan has given a very, very clear roadmap where the district is having clear understanding and all the players are having the same understanding or not. Then the accountability, how we can ensure the accountability among all the functionaries, all the stakeholders, and the responsiveness for getting the better nutrition outcome.
And the IIT Bombay came to know about us, our program, and then they wanted to basically replicate our training module into 10 minutes video tutorial. So we started basically training healthcare workers, parents and family, doctors and nurses, our healthcare workers, and our mothers and other NGOs. We basically use our time-tested IYCF protocol. These are protocols which are created by us, use of technology. So with the help of IIT, again, we are making these free videos. We have also started the real-time professional help. So we have this toll-free number, 1-800 toll-free number, where mothers, healthcare workers, if they have any questions on maternal nutrition, lactation, they can call us and we would call back within 24 hours. And that is in 5 languages right now, but our goal is to have 22 languages. The reason it is called spoken tutorial, because it is meant for mothers who are not at all literate. So they can understand what has been spoken, but nothing is written on the videos. So that way anybody can learn it. It's basically skill learning.
These are the 3 aspects I'm going to discuss. One is nutrition surveillance system. It's the digitalization program. And then ICT based monitoring of commodity supply chain and beneficiary wise tracking. This is already several states are already using. And then we have also recently developed and inaugurated this Nutrify India now. It is a mobile app. What is the nutrition surveillance exactly? To watch our nutrition continuously in order to make concurrent decisions and actions, immediate actions, by which nutrition improvement will be taken place among various population groups. The basic this nutrition surveillance is it is a AAA approach. So it is an assessment, analysis for the reasons, causes, and then immediate action also important to overcome the gaps. So that's what we started now as a pilot project, and this is the conceptual framework how to go about from household level to Anganwadi centers, then sector level, project level, district level, then state level and country level. So
just like to highlight some of the crucial takeaways that we have, that at least I have sort of taken in today. The inaugural session, it contextualized for me quite a number of issues that were then taken up quite a few times in the sessions. One was that we should have a comprehensive approach, where we have a multi-sectoral and comprehensive approach and a convergence approach, because that is something we don't have today. So where we have awareness, health, sanitation, dietary habits, participation of men, and access to hospital and other facilities. Very good point that was made was about investing in adolescent girls. Because today, even in India, we have had no specific program for adolescent girls. And so focusing on adolescent girls is one of the most important takeaways that I have got from this conference, and that we should have a comprehensive approach to remove barriers to adolescent girls' development and welfare, and a gender-based nutrition strategy, which is very important. The other point that refrain which came again and again was involving men and the community, which is very important because women don't make the decisions about food, it is as one of the speakers said, the mother-in-law, very crucial. Then the other point that was made was regarding energy-dense recipes using community resources. This is something even when, I spoke earlier, once we used to have chat with Meera ji, she spoke of using indigenous resources and community-specific diets rather than giving them a diet which is coming from some kind of global agencies. So energy-rich, dense recipes using the community's own resources. The mention was made about micronutrients, where the focus was on diet diversification and food fortification with specific attention to individuals and communities again. And then we came to technology, where the digital facilitation goes a very long way, probably not just in providing any kind of support facilities to the program implementers, but also in monitoring and data collection, which is very weak in our country. And the spoken tutorials seemed very interesting, and I think very interesting way of communicating with the people in the rural areas, especially where illiteracy is an issue.
I'll take a little longer than Manjula Krishnan took because I will give you a recap of what we've done during the day, but I'll do it very, very quickly. I think it's been a wonderful day of learning. We've had extremely rich presentations and a lot of fabulous inputs that we've got from our friends from other countries as well as from the many people who came from other parts of India. We started the day with talking about anemia being a silent killer, that this is damage that cannot be repaired later in life, that no mother or child deserves to suffer more than suffer when the cause of that suffering can be addressed, that we need to correct stunting, wasting, underweight, obesity, and that this is a dire need and a foremost priority. We had some really fabulous voices from the ground. So we had people the communities with whom Sukarya is working, telling us about the difference that Sukarya has made, about the change that Sukarya has made in terms of institutional delivery, in terms of what they call tikakaran or immunization, in terms of changes in breastfeeding practices, in terms of using iron kadhais for cooking greens in particular. However, they also pointed out that while they are getting the benefit of these services, that there are slums as well as villages near wherever they are located that are still unreached and that do need to have their needs in this regard addressed. We learnt something very important from the ministry, and that was that a weak child today will make a weak nation tomorrow. That poor nutrition causes 45% of deaths in children below 5. Then of course the stunting, wasting, anemia levels which are high. That malnutrition is a cause as well as a consequence of poverty. That there is a 10% decrease in lifelong earning ability because of malnutrition. Very importantly again, that there are regional disparities in malnutrition. That 60% of the burden is in lagging states like Bihar, Chhattisgarh, Madhya Pradesh, Rajasthan, UP. However, there's also an 8% burden from Andhra Pradesh and Maharashtra. That there's a need for sustained efforts, that there's a need for a multi-pronged approach, for grassroots synergy, for convergence across departments, and therefore the importance of Poshan Abhiyan. We were told about the need to focus on the first 1,000 days, but the question then is how. And we were also told about the need to empower frontline workers. Again, the question is how. Despite expansion of the ICDS, we know that nutritional deficiency is unacceptably high, that there is need for convergence, but again, how much convergence is actually taking place, and need for socio-behavioral change across communities, the need to create aware communities, and the need for a Jan Andolan. And this is where a lot of NGOs have direct space to come and make a difference. We were also told that Swachh to Swasth, and that 40% of India's population is below the poverty line, which I would endorse, that we can do well only if this 40% does well, and I think that too all of us would endorse. That we need to go bottom up and not top down, that it's great that Sukarya is working with men and with panchayat leaders as well. We were told that the first 1,000 days are critical because 20% of stunting is in utero. The issue of violence was flagged as a problem, violence against women, and the need to empower communities, to empower them to demand services from government, the importance, and also, questioning what was said earlier in the inaugural session. The point was raised that yes, 1,000 days, but 1,000 days counts the time from preconception right through until post-birth. And so that's the 1,000-day window. And if you are not going to address the needs of the girl child or the woman who has yet to have a child, then she doesn't get access to the ICDS, and so you're not addressing the 1,000-day window, which is the critical window for nutrition.
So my first commitment is with me, that is to my community. The second commitment is with NCPCR. So the dissemination will be submitted to the NCPCR for approval on 3rd. So once they accept it and make it official, then only we would like to propose it further, or if they want to propose it further. And of course, this is a wonderful dissemination of the day of brilliant minds, and I cannot be more proud of the fact I feel successful over there. So I just need to thank all of you actually. Thanks actually to my co-sponsors, first of all. It wouldn't have been possible. Thanks to the birth group, very especially, they have actually worked hand in hand. Thanks to my two co-right hand and left hand, and thanks to all of you. And so thank you so much for being here today. Actually, my effort has been successful. I think we pulled it off well, and the success is actually for Sukarya. It's not for me, and it's for all of us. And actually, the credit of or the result of this conference has to go back to the community. That is the whole idea. Thank you so much.